This guide will talk you through how to complete a wound assessment in Systmone, which is a key part of our patient care. In the care plan, go to the Complete a Wound Assessment and select the link to bring up the template. All tabs in this template must be reviewed and will land on the wound history section, where the date of the onset of the wound can be entered if this is known. Or if the wound onset date is not known, you can go to the following field and use the preset notes to determine the approximate date of onset of wound. In the example shown, this patient has come onto our caseload with an existing Category 4 injury for approximately 0 to 3 months, so we'll select that. If the wound upon observation is healed, select the tick box and date, and this entire template is now complete. However, if it is not healed, you must continue to complete further information. To support the wound being healed, an image should be attached to the record. Select the Attach File icon after confirming the date of healing on the template. Find the image which you have emailed to yourself from your work mobile device and saved to your desktop. Ensure that any commentary against an article includes that the wound was healed upon examination, and select OK. If the wound is not healed, carry on to select the wound type and site field. Now select the wound type and site. If you are using a specific care plan, this will automatically populate the pressure ulcer grade or wound type. If you are using a generic care plan, you must select the most appropriate from the drop-down list. If using a generic care plan and you identify a specific type of wound, the care plan should be ended and replaced with the new care plan, which is specific to the injury or wound being dealt with. Continuing with this care plan, please do enter any generic condition of patient notes suitable. In this example, the patient is known to have dementia, so this is relevant to the wound assessment. In the next field, detail the wound site. So in this example, we will enter the sacrum, as that is where the wound is. You then need to select the relevant care plan that it's related to by selecting the preset notes, and it should automatically populate the specific care plan you are using. Using the diagram, then key in the wound area. For pressure ulcer wounds, please ensure that you use the colour red to indicate the wound area. If a Doppler assessment is required, please use the link to go to the Doppler assessment template. However, on this occasion, as the wound is on the sacrum, this is not relevant. So we move to the next tab, which is the Delayed Wound Healing tab. If appropriate, document delayed wound healing by ticking the box there to show that there is significant harm to the patient. However, if it is a new wound that you're observing, then there will be no delayed wound healing and you can move on. Once selecting delayed wound healing, please do ensure that you select all the tick boxes appropriate to potential reasons why the wound is being delayed in healing. Next, please document any allergies or sensitivities, including any to dressings. So select the link Record Allergy or Sensitivity. Once this is selected, please do document this. So if there's no known allergies, please select the appropriate radio selection, any comments, and select OK. Likewise, if there is a drug sensitivity, select the pill box icon to bring up the list of medications that you need to document. In this example, as a safety feature, the patient has been recorded as no known allergies on this time. However, previously, an allergy to dermal has been documented by another clinician. This cannot be overridden and is a safety feature, but will also allow you to ensure that you can see any known allergies in this section. Now move on to the Wound Evaluation tab. Now enter the length of the wound, which should always be from north to south of the wound. North in this instance should be the patient's head. Please enter any measurements as detailed, in this case in millimeters. If there is no depth to the wound upon observation, tick the box Superficial Wound and then complete the field Body Surface Area of Wound by ticking the box and entering the body surface in millimeters, which is the length times width. If there is depth to the wound, please ensure this is measured and recorded in the field Depth of Wound. If you have recorded some depth to the wound, please set the tick box Open Wounds NOS and use the edit facility to enter the sum of the length times the width times the depth in millimeters. If there is any undermining of the wound, this needs to be selected and documented. When documenting the undermining of a wound, please define the area by using the clock system. So in this example, we're saying it's from 12 o'clock to 3 o'clock to denote the top right-hand corner of the wound. Now use the various fields about the wound bed to define any skin conditions that you find around the wound. The sum of any documented percentages should always add up to 100%, and always use the preset notes available on the right of each field for quick and easy entry of these particular aspects. Now move on to the Wound Evaluation Exudate tab. In this field, you first need to describe the exudate amount. This is either defined as none, light, going on to the primary dressing only, moderate, seeping onto the secondary dressing, or high, saturating the secondary dressing. Then describe the exudate color by selecting one of the 4 options available in this field. Then document the consistency by ticking the consistency box and using the edit function to populate thick or thin. Next, document if you've observed any signs of infection, either an offensive wound odour, if the skin over the lesion is hot, or if the wound is deteriorating. If a swab is taken, please indicate this. However, swabs are not taken routinely and would only be used to confirm that any antibiotics being used by the patient are being effective. Moving on, in the wound observation field, detail the wound edges as observed. Now, using the tick boxes available in the surrounding skin category, detail any observations of the surrounding skin to the wound. Select as many surrounding skin observations as appropriate, and then move on to the next tab, which is labelled Wound Evaluation, Dressing and Quality of Life. When completing the Dressing and Quality of Life fields, please do ensure that you mark the wound pain severity, anything between no pain and persistent wound pain. You must also ensure that you complete the pain chart link if the patient has declared that they are suffering from pain from the wound. So in this example, the patient has a pain at dressing change, and then we go to the pain chart, and the absolute minimum is to complete the pain severity from the drop down available. If possible, please do expand on that and answer the questions below with regard to what makes it better and what brings on the pain. If the patient is non-verbal, use the Abbey Pain Scale tab instead. Please do note that if the patient does declare any pain level, this is an actionable task, so it may consider that a patient needs to be referred to their GP or some pain relief methods discussed. It is not just a click task. If time does not allow you to complete any referrals immediately, please do use the new task function available to you to document a reminder to yourself to ensure that this is carried out. You can also add your nursing notes at this stage if relevant to the wound assessment. However, this can also be added separately by using the nursing notes link at the top of the patient's record or in other areas of the care plan. We do also need to document the patient's quality of life and document between 1 and 5 as indicated on the screen. This is something that can be tracked and can be audited. Towards the end, you can now select the tick box Advice about treatment given when you can have given any advice to the patient or carer with regard to their wound, and type any text in the appropriate field. The wound assessment form is now completed, therefore you can select OK at the bottom and carry on with the remaining instructions as listed in the care plan.